there's times where I probably should have taken some teeth out at the start and was a little bit in two minds about it.
Your aligners and your fixed ortho. It's like being Man United and Man City at the same time.
A lot of places, a lot of practices, they will only offer aligners. And so for me now, it is a bit of a selling point.
I wanted to just pick your brain then in terms of where you're finding you're more likely to use fixed or way more likely to use aligners. So welcome guys to another episode. Today we're with a special guest, Dr. Omid, who is here in KISS Dental. Really nice practice. Just been getting to really find out more about Dr. Omid. I've met him for the first time today, and you guys will get to hear a little bit more about his story into orthodontics, fixed orthodontics, and clear aligners as well. So no, thank you for having us today and hosting us.
You're welcome. Yeah, thanks for coming. Thank you so much for speaking to me. It's a privilege.
So just give us a little rundown of the history of KISS Dental and especially this branch here.
So I'm one of the associates at KISS. It's owned by Kailash Solanki. I think we've been going a good 15 years or so. Based all around Manchester. We're in Bramhall today. This is one of the newest practices, and this is actually Dr. Callum Coombs' practice. Okay. He's kindly let us use his space today.
Yeah.
But yeah, I work with KISS now for I think 7-8 years.
Yeah.
And at this point, just providing the ortho for the practices. So I'm a good 5 or 6 of the 7 KISS dentals at the moment.
So you've got a unique positioning because you're an associate who's mainly doing ortho, and I'd say you're functioning like an orthodontist who would get referrals for cases. I mean, it's not really something I see in a lot of associates. How do you get to that sort of position where you're now tackling more advanced cases? You're showing me a deep bite case that you corrected. You didn't even see the patient for 3 months and deep bite just magically corrected. You know, how do you get to this sort of stage in your dental career? Because it seems like a very niche position.
Yeah, well, it's taken a lot of time. I'm qualified now 13 years ago, and I've had good groundwork done sort of in NHS dentistry first before moving into the private sector, and I've sort of slowly introduced orthodontics into that, probably starting about 10 years or so, starting with the classic, short-term orthogonal systems. 6-month smiles was one of the ones that I started doing. And yeah, a little bit of clear aligners at that point. But yeah, I started doing it and I thought, I love this. This is the only bit of dentistry so far that I can do. And like, it doesn't feel like work. I really enjoy doing it. And so I thought, yes, I need to do more and more of this. But when you start doing those first cases, you realise, even though you've been on the weekend course and the guys running it have told you that you're all set and you're ready to go, you know nothing really, and you don't even know what you don't know, and you need to get on some courses, which is what I did. 10 years later, I've still only just finished an MSc, which I've been working my way up for 5 years. I've literally been on courses for that full 10 years to try and learn as much as I can about what is quite a difficult subject that I don't think anyone actually understands fully. So all about educating yourself, and you do have to push yourself and take on cases that are at the edge of what you can do, but as long as you're doing that with the backup of someone that you can fall back on if you need to ask something. And so I've just kind of built it up over time, and probably for the past now 4 years I've pretty much exclusively done ortho with just a little bit of bonding sometimes at the end, but I don't really do any of the bits of dentistry anymore.
So I want to rewind a long time ago when you first started, when you had your first ortho case, because a lot of people fail to get past that hurdle of, okay, let me have enough courage to just do the first case. They've done some theory, done some reading, maybe even done some courses, but just tackling that first case. How was it for you? Just getting to start and put your hands on the first ortho case.
Yeah, it was exciting for me, and I think that's why I knew that this is something that I need to do more of, because as soon as I did it, I just it was a fixed one. It was brackets and wires. It was 6 month smiles. And, looking back, it wasn't as good as it would be now, but at the time, the patient was really happy. And, I just physically enjoyed doing it. I guess it's important that those first few cases go fairly well, because I know people that at the same time started to do some cases and they didn't go so well, and they thought, right, no, that's not for me. I think now it's a bit different, because most dentists trying it will probably go for something like Invisalign, and it is a bit more straightforward to get started probably than something fixed like 6 month smiles. I think it's easier to go wrong more badly with fixed. You can certainly go wrong with Invisalign too, but there's a bit more of a safety net there.
Yeah. So, okay, you got past the hurdle of that first case. How did you even get to, let's say, your first 10 cases? Because that's another milestone, just completing 10 orthodontic cases. Where did they come from, those cases?
So I think those first 10, they would have all been just when I was working in NHS practice. And yeah, maybe 10 years ago, it wasn't like it is now, that every practice was doing a bit of Invisalign and a bit of ortho. So it was a bit less common that we were offering that. So there was a little bit of word of mouth, a little bit of advertising. And I mean, to start with, it's a lot of nurses that you're treating and staff and friends of the practice while you're learning the ropes. But
what staff members did you get to treat?
Well, plenty of nurses over the years. I think my wife's probably on her fourth orthodontic treatment at this point. Don't think she's got any roots left. Anytime I learn something new, I'm like, right, let's try this. But I think once I was working in Wigan, which is I think around there weren't a lot of practices that were really offering it. So as soon as some dentists knew that there's a dentist that quite likes doing this, then I was able to get some referrals fairly quickly. But I think it was once I moved into private practice here, I met Kayla Schwann's Kiss Dental on a restorative course, and I think he was looking for someone to do some of those short-term treatments, and I could see that it was something that I was really into, and so he gave me that opportunity. And once I was in a private practice with a lot of new patients coming in, that was where I was really able to start doing a lot of work.
So it looks like your confidence grew over time with the courses you were going on, successful cases early on, to the point that you're now working between 5 practices, soon to be 6, just mainly doing ortho cases. Would you say that's fair in how your confidence grew? Is it something that's repeatable, that someone else could follow a similar path to grow their confidence? Because I think it's a big thing in people doing more ortho, having that confidence.
Yeah, I think so. I think it's seeing the successful cases, getting your photographs, seeing where they started, where they finished, seeing the difference in that patient's confidence by the end, and knowing that you've contributed to that.
Yeah.
So, having that confidence of the successful cases, having the confidence of, the knowledge is super important. You do have to do the reading, do the courses if you want to do well, if you want to do it properly.
Yeah.
You do need to know what you're doing. It's easy to get, I do see people getting overconfident sometimes, and they're only starting out and they're sort of very reliant on just the Invisalign clean check, and it comes back, and they've not really put too much thought into it, and they've kind of assumed that there's a lot of thought on the other end of it at the lab, when there's often not really. And I think it's easy to land yourself in trouble.
So you've put it very nicely. Basically, some people like myself used to just let the algorithm plan the ortho cases, and then hopefully just fingers crossed.
And I mean, sometimes it can work out, to be fair. A simple case, you can certainly get away with it sometimes, and I think that's why it's easy to get overconfident. If you pick a case and you give the lab no instruction and you still get a decent result, then you think, gosh, this ortho game's easy.
In ortho, you can go on the courses, you can start treating cases. I find that my biggest learnings have been from things that might not have gone to plan with patients, where it's then really stuck out to me to say, okay, I don't want to be in this similar situation again. What can I do to never get to this point? So one patient that comes to mind it was a deep bite case. And this gentleman, he was really I think he was an engineer by background. I'd done the whole thing of promising him the world and showing him the clean check. And then the clean check, the deep bite was resolved. It was looking great. We did the treatment. 3 refinements later, his alignment is great, spots on, his overbite has improved. But this guy, you know, he looks at the clean check and he's like, my teeth don't look like that. My overbite has not corrected the same way this clean check. Tell Invisalign that, you know, they haven't done it. They haven't done a great job. And it taught me that I need to have more knowledge in setting patient expectations the correct way. And me being able to interpret a clean check to see, okay, what's actually going to happen in reality. Are there any patients or any situations that come to mind where it was like a learning moment for you?
Yeah, I mean, you know, I've certainly made plenty of mistakes, things that I've learned from. We've always got to a decent outcome by the end, but sometimes I will have gone quite a roundabout way to get there. I could have got, you know, there's cases that have taken longer than they should. I think one that definitely takes some time to, and it is an important decision, is with extraction cases. And there's a real art to that. You know, there's times where I probably, you know, should have taken some teeth out at the start and was a little bit in two minds about it. And I will usually have that discussion with the patient and perhaps then midway through treatment, taken some teeth out and corrected things and gone on the right path. But that definitely that takes some experience to recognize, you know, when we definitely need some teeth out, when we don't. And so there is definitely a bit of a grey area in some cases in between. Like you were saying with ClinChecks and, you know, patients expecting it to look like that you don't make the same mistake twice. And when I show patients the ClinCheck, I will always say, if you wear your aligners, if you come to your appointments, like, we can definitely do this, which is usually the alignment bit. And then bits like deep bite correction, I will say, you know, this is really variable between people. It depends very much on your physiology. Best case, we can get to this. Realistically, you know, we may get here. Worst case, we might not get much improvement at all. So there's certain things that I tell them, like, this will happen, this might happen, and this probably won't happen.
Yeah. Do you have certain people that are your go-to for maybe getting a bit of advice over a case, or, you know, just having another pair of eyes looking at things? Do you have people like that? Do you have, you know, some form of mentors? How has it worked for you?
Yeah, I certainly have in the past. You know, on my master's course, I always had people that I could contact and get advice on a case if I needed it. These days, I'm pretty confident at knowing what I do need to do. There's still the odd case that I will refer on, usually, you know, the ones that are going to want some surgery. I don't tend to do those. But often it's just with peers and, you know, dentists similar to yourself. We might have a chat between ourselves. How would you approach this? So it's a bit more of a casual approach, I guess, now. But in the past, certainly, I would have had mentors and people that I would send all the records to and say, this is what I'm thinking. Am I on the right lines?
Yeah, no, I think it's really key to have mentors, especially when you're starting out, because they're going to see the things that you would never see otherwise. And it's a great way to speed up your learning curve. So yeah, definitely recommend having some people that you can bounce ideas off. You're quite unique in that you haven't picked a side. You're aligners and you're fixed ortho. It's like being Man United and Man City at the same time, you know?
I do support United and City as well.
It feels like you're either one side or the other. Sometimes when you look at, you know, social media and groups, what's made you comfortable being able to use both fixed or aligners together for the benefit of your patients?
I mean, I just think they've both got good strengths and weaknesses, and I think being able to offer both, well, it serves me well now, I think, because a lot of practices, they will only offer aligners, and so for me now it is a bit of a selling point that other than orthodontic practices, not a lot of cosmetic practices are really offering much of a fixed option. So these days I'm seeing more, you know, teenagers and kids that are stuck on very long NHS waiting lists, and you know, I'm able to take those patients on for some fixed ortho. So it works well for me to be able to offer both, but I think they complement each other well. There's a lot of cases that I'm happy to treat with either one, But then there's some cases that I would much rather we treat with aligners, and I'll steer the patient a little bit down that route, and there's some that I would much rather treat with some fixed.
Yeah.
And so it comes down to the clinician. There are some amazing orthodontists out there that can treat anything with aligners, but they have to incorporate a lot of other elements to make that happen, mini implants, etc. And equally, some very skilled orthodontists, they can treat absolutely anything with fixed, and they will still. That's the way they want to do it. So it depends on the clinician as to what result they're going to get. But yeah, for me, I really like the mix of doing both, and I'm probably about 50-50 on how much I actually do in terms of numbers of cases.
Yeah.
I like having that split through the day, and if I was just doing one or the other, I'd probably be a bit bored. So the mixture makes it more interesting.
How do you then decide on things like pricing for your patients, whether they're doing fixed or whether they're doing clear aligners? So more from a clinician perspective, how have you settled on what a fair price would be for either or? And just give us a little bit of your thought process.
It's a good question, and I make it super simple usually, and I actually will charge the patient the same regardless of which one they want to do, because I kind of don't want the cost to be the deciding factor, unless I am really trying to steer them more towards one or the other, and then I might make that one a bit less or the other a bit more. But on the whole, I will charge the same, because obviously Invisalign or clear aligners, I'll have a bigger lab fee to pay, but I usually need quite a bit more chair time for a fixed case as well, so I feel it kind of balances out a little bit. So yeah, to keep it simple, I'm usually charging about the same for either option.
Yeah. Do you finish cases in 3 months or 4 months?
Not very often.
So if I want the quickest, I shouldn't be coming to you.
No, definitely.
I've found that my treatment times have been getting longer.
Yeah.
The more I see.
Yeah,
to,
I think
to
that's
do
probably, sometimes that's to my detriment with new patients, that I want to always do it properly. And in the past, I would have probably settled for a 6 month smile kind of treatment. And now my standards are too high and I want to do it properly. And I think probably that sometimes puts people off because they want to do something quick. But I'd rather be doing stuff that I can be proud of.
Yeah. It's a funny one. One of the consultant orthodontists that I used to train under, he used to say, if my patients with fixed orthodontics wanted a 3 month smile, I can give them 3 months worth of fixed ortho, but that's not the ideal end result. So it's just amazing how, as you get more experienced, you probably don't want to be doing things in 3-4 months.
Yeah, I mean, obviously there are some, they just had a bit of relapse and they've had ortho before. There are some.
Yeah.
Yeah. For most people, I'm telling them it's going to be 12 months plus.
I wanted to just pick your brain then in terms of where you're finding you're more likely to use fixed or where you're more likely to use aligners. So how are you deciding what's best?
Well, I think things that would steer me towards, the biggest thing that would steer me towards fixed is if I don't think the patient's going to be very compliant with aligners, because obviously that is absolutely key. And if it's Invisalign at the minute, or it's 22 hours a day that we need, and some patients know themselves that they're not going to be able to do that. And for them, I always say you are going to be best having something stuck to your teeth that you can't take out. So I think a lot of the ones I end up doing fixed, that's why they've come to me, because they've said, I really don't want aligners, I'm not going to wear them.
Yeah.
Other ones where I'd lean more towards fixed are the ones that we know are slow with aligners, so really rotated teeth. Things that aligners are not as predictable at treating, like a deep bite, generally more successful with fixed. Well, again, it comes down to compliance, but very often with teenagers, I do treat some teenagers with Invisalign, but generally I think fixed is the way to go. Conversely, with aligners, for some patients, aesthetics are absolutely paramount, and so you're gonna try and go down that route if you can for those patients, as long as the compliance is going to be there. Certainly, heavily restored dentitions, they're a bit of a pain, sticking brackets to crowns and big fillings and whatnot. More bracket failures and things. So I steer more towards aligners for that. I find they're really nice for like a mild anterior open bite. Aligners work really nicely because you get that bit of intrusion of the molars. And you can treat those quite quickly and quite successfully with aligners. And also another one is sort of generalized mild to moderate spacing, those gaps close up really nicely with aligners too. Where you're working around teeth that you can't move, so whether it be implants or deciduous teeth, because of the digital planning, it's nice you can work quite well around those kind of cases, which again, when you're putting brackets on, it can be a little bit of a pain. And missing teeth as well, where you can put a pontic in the aligner, again, annoying to do with a fixed ortho. So I think those are kind of the main ones that I will steer on one side or the other.
How are you approaching then retention? Because I feel like it's one part of orthodontics that there's no one defined answer to how to approach this. So in this moment of time, it might be that it changes in the future. Or how are you looking at retention?
Yeah, so I will try and, for everybody, do fixed and removable retainers. Always fixed in the lower arch. I will usually get fixed in the upper arch as long as we've got enough space. And then, removable retainers, either standard Essex retainers or Invisalign Bavaria retainers, and every night forever, basically, is what I will tell them. I don't sort of get them to phase it down, because I think it just gets a bit confusing. Some people will say wear it every night for the first year and then every other night, but I think keep it simple. Every night. I usually will go straight to nighttime wear as long as I've done some fixed retainers, but if I haven't, then I will get them to wear them full time for a good sort of 3 to 6 months before we go down just to nighttime.
I find like for myself, it's something that's evolving and being tweaked here and there. So recently, one thing I'm now doing more of is where there's been heavily rotated laterals. So you've derotated it, you've placed a fixed bonded retainer, but I probably want my patients for the first few weeks to wear their retainers full time and then transition into nighttime basis. So I feel like with myself, I'm always tweaking my retention protocol with what I'm seeing working in my hands anyway.
Do you tend to do a direct fixed or an indirect or lab made one?
So I do a lab made one, a jig. So basically, for those that don't know, the lab makes this jig for you, which you place on the teeth, and the wires manipulated to bend around the teeth, and you just simply bonding the retainer to the teeth. I find that it allows me to make it much cleaner in terms of the bonded retainers, and it's very quick as well. And the lab can turn it around within a week for me in terms of bonded retainers. And I like any excuse to keep my patients just maintaining that result, getting things to settle. So that's the way I look at it at the moment. How about yourself? Are you placing them directly?
Usually, I like the OrthoFlex chair side stuff. You can usually get it fairly well adapted. Only time I tend to do a lab made one is if it's, say, a case that I've not treated myself and it's replacing an old fixed retainer and they're not sort of perfectly aligned. It can be a bit tricky to get it really nicely adapted if they're not that well aligned. So for those, I'll get a lab made one.
I'll have to watch how you do it. You might convince me to start just doing mine directly as well. But I guess the benefit there is you do it there and then. And then it's sorted. What's your turnaround time like for locally lab made Essex retainers?
Well, here we actually we're starting to do them on site now. So should be, same day. But normally we can get them back within a couple of days.
That's good. That's good. Okay, so that's retention there. What would you say are, I guess, the top 3 things that a person who wants to really take their orthodontic experience further, what 3 things would you really say to them?
I would say, find a good course. We keep going on about courses, but it is so important to get that knowledge. There is so much stuff to know for ortho, and the companies that want you to start using their aligners make it sound as if you don't, there's very little to know and you can just crack on and do it. But it's so important to get that understanding of how teeth move, the etiology of why people's teeth aren't straight. You need that knowledge before you go and do anything too complex. So find a good proper course, a good year or so with a mentor. I think you need that backup. So getting on a good course, finding then the second one would be having a mentor. So find someone nearby that you can fall back on if you get yourself into trouble, and someone that you can refer the more difficult cases to.
Yeah.
And then I guess the third one is just experience and just do it and enjoy it. And if you enjoy it, keep doing it and learn from every case, and you'll get better and better. Yeah.
And in terms of, I guess, what's exciting you the most right now, because you've been doing ortho for some time now, what excites you within ortho at the moment?
I mean, looking at the new things that are in development at the minute, I'm quite interested in these like memory shape aligners.
Yeah, I've seen that.
Possibly, there's ones that could work with just nighttime wear, which I was very skeptical of, but I'm interested to try because they use a really cool technology in that there's sort of a few steps built into a single aligner rather than just one step.
Yeah.
There's a lot more research going to be needed, but it's something that if that is possible, then that will be so attractive for patients to be able to wear something just at night time that will actually successfully straighten their teeth. So yeah, those are the kind of things that I'm looking forward to seeing how they develop.
Yeah.
How about yourself?
So actually, it's interesting that you mentioned that the memory shape aligners, because I've seen a dentist, I think he's in Japan, who uses aligners and then he finishes his cases with the memory shape aligners. So that's been looking quite interesting. I like the thought of using the mini implants, the TADs, temporary anchorage devices. That's something that I'm looking into. Do I want to step into that? Is it necessary? Is it needed? But it looks like a great way to get that extra anchorage, again, to overcome the things that aligners would inherently be weak at overcoming.
For sure, I think if you want to do the most difficult cases with aligners and not lean on any fix, then I think it's something to look at adding to the armamentarium. Yeah.
You mentioned that sometimes you treat teenagers, children as well. What gave you the confidence to step into that? Because that's another level of, I guess, responsibility and I guess experience that you need. Because the saying is, with kids, it needs to be an ideal results. With adults, a realistic finish. So, what made you confident to then step into treating children?
Well, it's taken me longer to start treating, teenagers, and I would always tend to refer those on for a good while. But yeah, now most of them I'm happy to treat. It's just the confidence of knowing that yes, I do know what to do. Yeah, I do know how to approach this in the right way. Yes, I can get a good result. And there's still some that I'll refer on, but on the whole, just from having done now the number of cases that I have successfully, it's having that self-confidence that if I send this to a specialist down the road, they're not going to do it any differently to what I'm going to do. Yeah.
What in your opinion makes for a good result?
I think it's got to be aesthetic and functional. So, a nice occlusion, teeth interdigitated nicely, in a stable position, sort of in the neutral zone between the tongue and the cheeks, so that it's not going to quickly relapse. But nice aesthetics too, a good smile arc, sort of following the curvature of the lip. Yeah. That's what I'm striving for.
Yes. I mean, you've got a wealth of experience. I've enjoyed watching the cases that you're putting up. As someone who loves ortho, seeing your page is just really refreshing. And you put some humor to it with the memes. I thought I saw in the comments said the meme king. So no, you're smashing it with that. If people want to find out more from you, get to ask you questions, maybe get your advice on ortho, what's best to contact you on?
Yeah, so I'm always happy to help, always happy to chat about ortho. Best place to find me is on Instagram. So at the Teeth Straightener is me. Drop me a message, and always happy to chat about straightening teeth.
Yeah, perfect. No, thank you for hosting us today, and I'm sure this is the start of many meetings that we'll have together.
I hope so. Lovely to meet you. Thank you so much.